All right, sorry for the technical difficulties. We got some devices off of Wi-Fi here, so hopefully we should be okay. If for some reason the internet will not allow us to live stream today, what we're going to do is we'll just record something and then post it to YouTube. But we're going to keep going here as long as we can. But I'll start over. So we're going to go through just some basics of X-Fix first, and going through some of the instrumentation that we have. We talk about wires. We have a bayonet tip wire as opposed to a drill tip. The difference is we have a wire, which is usually a 1.8 or 2.0 diameter, and then you have your half pins, which are usually 345 or 456 millimeters in diameter. Half pins are usually saved for the proximal tibia or one in the calcaneus. They do add some stability, but it's a much larger hole. You're only going bicortical with these, and there's only one of them for each plane. For a wire, you're going to put two in a plane, and you're going to go all the way through the leg. We'll demonstrate both in a little bit. The other thing is when we talk about wires, we have smooth wires, and then we have wires that have an olive to it. And we don't have any today, but what they have is a little bit of a bead right here. So when we put our wires in, we try to get an angle that's around 30 to 45 degrees between the two wires, so that way we don't get as much translation and we don't affect the bend of the other wire. But in certain areas like the calcaneus, where we want the wires to be a little bit closer to parallel, or even in the foot sometimes when they are parallel, if we have a little olive on one of the ends, then it actually prevents the translation of the foot or the leg across the wires. You want to make sure too, whenever you're removing a frame, you look, a smooth wire is going to be the same all the way across without any markings on it, but an olive wire will actually have a few black marks on the side of the olive. So you want to make sure that you cut on the opposite side when you're removing the frame and pull towards the black marks, so you're not trying to pull the olive all the way through the bone. So those are wires and half pins. Once we move across, so we have tensioners of two different lengths here, and they all have a different amount of tension we're going to achieve on it, and it's distally you're going to go with a smaller amount of tension, and proximally you're going to go with a higher amount of tension. We have some wrenches, we have crack pipes, we have some pliers, one more tensioning. We have these, theirs is a wire bolt wrench, but basically what we're going to do is we're going to slide into the bolts this little peg right here so nothing twists, and the wire goes over the cannulated part so we can tension from the other side, which we'll demonstrate in a little bit. We have a quick connect device for your half pins. We have some wrenches, and then in our set here, anytime we start off, we're going to get your nuts and your bolts ready to go. When we look at a bolt, every company is going to be different, but you're going to have a larger diameter area, and then you're going to have a smaller diameter area. So the way that Stryker makes theirs is it allows for this male end to go into the female end of the bolt, so that way it doesn't twist when you tension it. And underneath we have, I'm going to grab a wire here to demonstrate. The wire will sit underneath this slot, or it'll go straight down the center where they have a hole as well. Hopefully you can see that. So two different areas. When you're deciding which one to use, we want to make sure that you're not putting too much bend on the wire in the frame. So you kind of let it sit where it needs to be, but they both give you an idea of where you can place the wire. Obviously getting one right in the center there is going to give you a little bit more stability, but sometimes we can't get that. Whenever you start off a standard static frame, which is what we have pre-built here, a standard static frame is comprised of a foot plate. We have some struts on here right now, and if you don't want to use struts, we have threaded rods. We don't have any of this set, but the other option is some threaded rods, which are literally that can take the place instead of struts. Struts they do give you some more stability because they're thicker. They also allow you to get some motion, and they can make the frame dynamic by loosening everything up and adjusting it. But we're just going to go over a static frame today. And then you have what's called your tibial block, which are two rings instead of the foot plate, which is a U-shape. Two rings up top connected by some rods. And you want to make sure everything is perpendicular. Depending on how you're putting it on, sometimes we just put it on like this where it's all perpendicular to the foot, but sometimes we're deformity correcting and we may build the frame to the patient. But in this case, we're going to go over the most basic, just static frame here. It's important preoperatively to measure. If we can zoom in, we kind of see there's there's measurements on the foot plates and the rings, so that way you know the diameter of the patient's leg. And sometimes they may have a really, really thick calf and a skinny foot. If you have a much bigger foot plate or rings and you have too much space, you can maybe get a little trampolining effect. So sometimes you can build it down and cone it down, but the more complicated you get, the more building off of the frame you get, and then you may end up making it a little bit more unstable. So we're just going to go over a basic stable frame today. We want to so when we're getting our nuts and our bolts ready for a basic static frame, we're going to have 2 wires on each of the tibial rings, and then we're going to have 4 wires, 2 in the heel and 2 in the foot. So we're going to have a total of 8 wires being placed. So if you're ever in a case and you want to get everything ready early on, what you can do is you can grab 16 nuts and bolts. So you're ready to go with that, and put them in a little tray, so as everything's being thrown, people from both sides can just go ahead and put everything in place. This is probably the most common case that we see students, residents, physicians, anybody contaminate by poking themselves. So just remember, when you're drilling through, these are sharp. So double glove for these cases, and just be careful that you're keeping a close eye on the other side. Additionally, if you're placing wires when the foot is on the bed, you want to make sure that we're not contaminating by poking through the bed that way. So just be careful when you're doing everything. Sometimes people will bend the wires so they know that they can identify and get out of the way, or clip them first to get rid of the sharp part as soon as it's through. But what we want to do is we want to start off with who's going to hold the leg here. So I'm going to have Suki stand at the end of the bed there. When you are positioning the leg, you want to, I'm going to get a little foam right here just to help you out this way. You want to make sure that as the leg is being positioned, I'll kind of bring this up here. There we go. If you're worrying about any areas of swelling, we have more soft tissue on the posterior calf. So that's the area we see people afterwards swell and actually push their skin up on the ring. Ideally, you want to have it so that way the leg is centered into the tibial block. But if you have to err one way or the other, you would err so it's a little bit anterior, because we're not going to have too much swelling because we don't have the extra soft tissue that we do anteriorly. But what we're going to do is we're going to bring it down this way. You want to make sure that when you're positioning the foot at 90 degrees here, which a lot of our patients end up having deformities, or they have equinus and we need to release that first, you want to get in a good position so that way you can be placing your calcaneal wires right above or below the plate. You don't want to be too distal here and then you're automatically building off, because the more we build off, the less stable we are. But it makes it tricky because the foot, the metatarsals, have a different position, different inclination basically than the heel. So we're going to be firing these at different angles. If you're going to have something be a little less stable, we know that the metatarsals are, so you'd rather focus more on the heel. As we're holding this here, Suki actually has one of the most important jobs of keeping everything in the center. So as we're putting wires in across, we want to make sure that it doesn't move on us. So there's different ways you can attack putting on a frame, but what we're going to start with is we're going to start with a couple wires that go from lateral to medial. That way we can kind of translate it if we need to and get something held down in place. If you're ever in the OR and maybe you don't have the fortunate ability to have a lot of people helping you out, you can take some towels and stack them underneath the heel here and put some towels underneath the leg and basically get the leg where you want to be around the frame and just build it up with some towels to hold everything in place, because we're not always fortunate enough to have a lot of extra hands for every case. If you have the frame pre-built, there are certain areas that we know are okay to throw wires, and we talk about safe zones going down the leg, so we'll go through that in a second. But we know we're never going to put a wire straight anterior to posterior in the tibia, so it's a good spot to put some of your rods here. You can line it up with the tibial crest so that way you know your center. And sometimes we'll leave off anything side, whether it's a strut or rod or strut or rod. We'll leave it off the side so that way you can have the ability to throw some wires and not be limited by anything in place. But we're going to start off with this one here. So if somebody else can hold the frame there. When we're actually putting in, so we'll go through some basics just for people who haven't actually gone through using hardware yet. When we have a K-wire driver with a wire collet on it, you want to make sure there's going to be two different sizes that we routinely have in our sets. One that 0.7 to 1.8, this is the striker, and then we have a larger one too, which we're not using at this situation. Some of them have the ability to have a variable amount on it. So if you get a wire collet that has small, medium, and large on it, you're actually just going to twist here to get a better grip on it. When you are assisting cases as a student and you're not really going to be at the front of the table doing anything, it's a great idea to practice while you're not taking up time from whoever's actually operating, switching these out, putting these on. There's a button on the side. I'll take the wire out. There's a button on the side. You push in and then you pull the wire collet out. And when you push it back, you're just going to press in with a little twist. If the battery's dying, we push down and pull the battery off and put it on. Sometimes we need new batteries in the case, depending on how long it is. Most of ours were okay. Then when you're handling, there's different directions. So the bottom direction is going to be forward, top direction is going to be backwards. If nothing's happening, you just need to make sure that you're adjusting the little lever or a little button on the side, because it'll lock it and you can't do anything. So it's a good idea to test these out before you hand it to whatever resident or attending's operating, and have everything ready to go. One of the biggest things we see wrong is, especially with drills, and when we're talking about a quick connect device like this, sometimes what happens is we think we put it in all the way and you hand it to somebody and then this just falls out. So always make sure you're pushing in and you're giving it a test. To demonstrate the quick connect, you're going to pull in on the collar distally, and there's a little flat area on this. This one doesn't go in here. So there's a little flat area. You're going to push in until it slides down and then let go of the little collar and give it a pull to make sure it's stable in there. This is the same thing, you know, for their half pin driver. You'll use these for drills, even cannulated drivers on power to put in screws. So just get in a good habit of learning how to use these instruments. Back to the wire collet. Are we dead already?
It was flashing a second ago, so yeah.
Was it?
Mm-hmm. Yeah, it had like a red flash.
Another battery.
Yeah. I don't think they brought any more batteries.
All right, we got a backup driver here we're going to use and kind of go through everything so we don't lose power. But this is the one that has the adjustable wire collet on it. We're on the, you want to pull out so you know you're on the right size and it's gripping it. This one, the large, is between a 1.6 and a 2.0. So the first step is going to be, we're going to slide this down a little bit here. And when we talk about safe zones, we know that in general, so we have to worry about the neurovascular structures in the foot and ankle. So we have your posterior neurovascular bundle, which is going to run back along the tibia and then come across your tarsal tunnel there. And then you have perforating peroneal up here. We have our sural nerve on the side. So what we want to do is, the safe zones in general are going to be throwing a wire laterally straight across. So I'm going to come right across with this here. And let me go on top. Are you okay down there? Yeah. So if you put the wire up against the ring, it gives you a little guide to go straight across. So once we get a wire across, you're going to get your nuts and your bolts, and we're going to find where it fits nicely on the frame. Unfortunately, these are exactly where we want them to be, but we're going to alter this a little bit today and rotate it a tad. We're going to come up here. So once you actually get the bolt down on, we get to look at the side here and we get to say, all right, how does that line up? Can you get a shot coming? How does it line up with the hole? So if it's going right down the center of one of the holes, then we can put it down the center hole on the bolt here. And if it's going a little bit more on the side, then we can put it through the side notch. So we'll put this one down the center there. Since we're gonna have different nuts here, those are the bigger ones. So initially what we're gonna do is we're just gonna tighten everything by hand. And then you can get one over there too. Is this the right size? No.
Those ones should be there, just so you know.
Yep. Good. Go ahead. You might have the wrong sizes there. Is that the right one? So while they're getting that one adjusted, I'm going to put another wire, and I want to get through a lot before we talk about some of the pitfalls, just so we make sure we have the right power to get through everything. Let me get another wire. Thank you. So we'll put a second wire in the tibial block here distally. As we're approaching the ring, if you see like the wire is starting to dive down a bit, we don't want to bend it too much, but what you can do is get a wrench and somebody can guide it. Who wants to guide? Let's guide it up top to keep, we try to keep them on the same side, but you can guide it up top so that way as we're drilling across, it stays on top of the ring there. Good. And then go ahead and put another. Ideally, you don't want to have them too close to any of your struts or your threaded rods because it's going to be a very hard time getting everything to tighten down, but we can adjust that later. I just want to get wires in before we lose power here. Thank you. So at this point we have the leg stable in the tibia, and if you wanted to, because everything is parallel like this, you could choose to slide the leg over, but Suki did a pretty good job of keeping everything fairly center right there. So this will be the last chance before we're going to then put our next set in. If you want to, you can go down to the heel, but with the calcaneus we're going a little bit of an angle, so it's not going to allow us the best ability to slide. If we remain in the lateral position and on the fibular side, we know that another good safe zone is just to raise up and then parallel the face of the tibia, the medial tibial face. So all you have to do is, if you think you're going to run into your wire, then you can come on the other side of the ring. If you feel like you're not going to, you can stay on top. Just for today, we're going to go on the bottom side. And when you're drilling into the tibia, what you don't want to do is we don't want to go right into the tibial crest there, because we don't want to have anything fracture off, and we don't want the wire to pull through the bone. So you want to kind of get in there and feel, and just go right behind tibial crest. And as we come out, this is when you can puncture into the bed. So good. And as he's got a wrench there, he's just guiding it on the side, and then we'll stop before we get in. And then another wire, please. Thank you. So we're going to do the same thing on the lower ring. This one's going right at the strut right there. So just guide that below. Good. Okay, you guys can put, from the bottom, put some nuts and bolts on there. There you go. So Chris, if you get a shot right there, in the case where you have a wire that's kind of splitting two holes, you can pull it a little bit to get it to sit in one of the slotted notches, but you don't want to be pulling it a lot so the wire is bending. And let's say, for example, do a washer. Oh, a thin one. So for example, if you get a shot right here and see the difference between one wire which is sitting right up against the ring and one wire which is a little bit off. If you have a wire that's a little bit off, you can do a little bit of bending just to get it to come to. But if you have one that's off far enough and you don't want the wire bent, you can add something like a washer. So with that, what you can actually do is keep the wire where you want it without bending, keeping it straight, and just elevate off of the frame a little bit. Adding a washer does decrease the stability a little bit, but not significantly. There's other options. Can I have some posts, please? Or just an example of one? While they're grabbing that, I'll put another.
Gosh, where are the reps?
Let me have another washer, please. Thank you. For yes, Mike, you can message in where all the posts are. Oh, here we go. This is an example of a threaded rod. So they come in So they come in a significant variable sizes. If you have something that you want to go much higher, you can obviously do that, or keep something pretty small. But when you're putting on a threaded rod, we have nuts for these, so I can show them.
Yeah.
That's okay. Thank you. When you're putting on a threaded rod, these are too small.
Oh, jeez, why do I have so many sides?
Yeah, we don't have any.
Thank you. Okay, good. So when we're putting together a threaded rod, if you want to get that built, we have to have a nut on either side of it to kind of hug the frame. So one easy way to do is just kind of spin it in to get started, and then you can slide it on your hand. And then that way you have it where you want it to be. Remember, you're going to be putting this in if you're building it on the patient, so you may not be able to, you may have to bring it up pretty far to get it to kind of come down to then get it into the next ring up. But it's just going to be, it depends on what you're actually doing. Thank you. Okay, so now we have the tibial block with wires set there. If we're going to hold off on tensioning right now because we want to use all the power before we talk about some other things, we're going to go ahead and put some wires distally. So if we're talking about the calcaneus, what we're going to do is, if we're going to come below here, you want to make sure that with the calcaneus, we're putting the wires, they can't be at the same angle we're going to put in the leg because we don't have the real estate for it. So these are either parallel with olive wires on there, or we're going to make them a little bit oblique. So we'll start going a little oblique with this one. Okay, good. So see how we started close to the frame here, but then ended up going far off on the other side. So that one will definitely have to be built up on the other side.
That's the last wire we have.
Okay. At this point, this is our last wire right now. We're not going to do any foot wires. But what we can do is you go to the other side of the leg if you're going to put an olive wire in to keep the olive on that side. But for purposes of this, we want to create something that's going to be a little bit of an angle. So let me come up top here. So see how that's going to bend too much going on top, so we'll let that go on the bottom. There we go, it fits better on the bottom. Ideally you don't have one that crosses from top to bottom, but we're going to do it in this case, just because we're dying on power. So go ahead, you guys can put some nuts and bolts there. Okay. We have another one over there.
Can I get a washer for you, please?
Good. we're going to show how to tension just the tibial block here.
Yeah, they're all
Um,
small.
What I want to talk about is when we're drilling those wires through, today we just kept going with it. But we do know that there's some level of thermal necrosis that can occur as you're putting these wires into bone, just like with any other procedure on bone. So what you'll oftentimes see people do is find ways to cool down the wires. And there's different ways of doing that. As you're drilling in, you can have a cold, wet lap just on it, so that way it's chilling it. You just want to make sure it doesn't get wound up. The wire doesn't get wound up in the lap. You can have somebody drip saline on the leg, or some people will actually have their wires sit in an ice bath before they're ready to use them to get them to chill and reduce thermal necrosis. The reason why we worry about that is at the pin to bone interface here, if we have a lot of dead bone, this is where it's going to fail. So we want to make sure that we don't have a huge void there, and we want to keep everything as healthy and stable as possible, because if it starts moving and toggling around in there, this is the area where we're going to see an infection potentially, or if you end up getting it too close to the tibial crust, then you could have a fracture of the wire pulling through there. Other things are, if you have an olive, you need to make an incision and then get the olive through. And what we oftentimes do is to limit the thermal necrosis. Once we get the wire through the opposite side of the bone, wherever we're drilling from, you may see an osteotomin mallet used to get through tissue. That can be beneficial too, because not only are you reducing thermal necrosis, but as you're getting to the other side, you're much less likely to have a wire go straight through a neurovascular structure or any vital structure. If you're just slowly tapping it through, it's going to bounce and move it to the side, as opposed to just trying to power through something. So this is a good start. And when we talk about safe zones, you can let go now, Suki. So see, now we can have it so that way you can attack everything as need be with tensioning and nuts and bolts and everything else. But when we talk about safe zones, in the leg, it's a good, there's many textbooks out there, but an easy way to remember is just sit starting laterally and come straight across with your tibial block, and then raise up and then have a wire that goes parallel to the medial tibial face there. If you wanted to put in a half pin, you want to put in a half pin, when we're going on the tibia, you're going to go in the center. You don't want to go too close to the tibial crest because you'll crack it. So you want to go right into the tibia, and then as soon as you get through, you want to stop and then finish it by hand, so that way you're not blasting too far through the tibia. Just remember, you do not want to be close to that tibial crest because these are a bigger diameter and you can crack them. So ideally we're getting through, and then you can see how it starts to poke out a little bit there to get it bicortical. You don't need to take it too much further than that. So those are going to be built up off. If you can put it right to the frame, but usually we're building it off because they take a larger diameter clamp. And what we're going to do is we're going to slide this off. And it's a one level of fixation, so it adds extra stability. Depending on what your preference is, you use them or you don't use them. The other area is putting them into the calcaneus. But we build them off here and then tighten everything down. The other thing we want to talk about, so as we got through the wires, make sure on the other side we're not into the bed. Now you have to strategically decide which way you're going to tension. When we tension, there's two things that can occur. One is if you tension all of one wire on one ring and then you go back and then you tension the other ones, it's going to actually deform the original wire a little bit. So as we would tension the second one, we may get a little bit of bending from that first wire. So in order to avoid the bending of your original wire, the other option is to tension both rings or both wires on one ring at the same time. So you need people on both sides of that. When you're doing that, you have to remember though, which one would be easiest and set yourself up in a good position. It's going to be very difficult to get a tensioner like this when you have the wires that are pointing into the bed. So we tighten these ones down first and then let the person on the opposite side tension up top. And then we're going to, because we have the tension on opposite sides, we would know that we're going to tighten this nut and bolt down and we're going to tension over here. The other thing that can create a challenge is in order to get the wire into the tensioner and actually grip, so once we're tightening down, we need to tighten this down, it has to grip it. And you may have, fortunately this one's long enough where I can feel it gripping, but you may have too little of a wire here to actually grip onto tension. So you want to try to give at least 3 fingers length on the other side, so that way you can actually grip with the tensioner. Otherwise, you're going to fail. So what we want to do first is, why don't you guys tighten down the bolts like we talked about. When you're doing that, there are different options. So we have some instruments here to use. And it's okay. When we are tightening, so we have different wrenches. We have a ratchet wrench. You can even slide the peg. So we're going to tighten down here so we can rotate the leg. We're going to slide the peg in and hold the wire straight, and then you're going to go ahead and tension the, flip this around, it's upside down. We're going to tension the, or we're going to tighten the nut and bolt here, so that way we can tension on the opposite side. So you can hold there, and then the easiest thing to do is tighten with the ratchet there. So we're tightening when the green is up, we're removing it when it's red. So go ahead and tighten that. By holding, go and hold the paddle at the same time here. By holding that, what we're doing is we're preventing the wire from spinning with the bolt. If you spin it, it's going to alter the shape of the wire. And sometimes we want that. So if we have a patient who follows up in clinic and one of their wires is loose, we can do something that's called Russianing, which is to, let me borrow this for a second here. What you would do with when you're going to try to Russian something is achieve some extra tension by not having a tensioner on. So once you were to get it tight like this, then you would take both and continue around, and you can see how the wire is starting to bend right here. And that would actually create more tension on the wire if you just had 2 wrenches in clinic and you would take one and then continue. Once you get the tension you want, then you finish tightening it with the other side and lock it down that way. So that's just if you're in a pinch in clinic and you really needed to tension something up. We're going to loosen that because this is the side we're tensioning on. Nicole, you want to come over here and tighten these? All right, so I'm sorry, Nicole. So tighten up here first because we're going to tension on that side. If you don't have the ratchet, you can use your crescent wrench or you can use the crack pipe to get in there. Good. So hold it straight. Good. Keep yep. Keep going. You'll feel it. Nothing? Okay.
I don't know later on.
That's okay. Let me see here. It may not be even tight first to start. So try to tighten it down first. Now we know it's really tight. So now we have the challenge of we trapped ourselves by putting this nut and bolt right next to our strut. So what we're going to be able to do is we can get the top part in, so we can't move it, but you're not going to be able to get the ratchet in. So do we have just a regular crescent wrench there? Good. If you can get the crescent wrench in, you can use that. Otherwise, this can be a good area to have a crack pipe. If you can slide the crack pipe on top, then you can tension it that way. We just have to keep coming off. So whichever one you want to use.
This one.
Okay. Good. And then is the bottom one tightened over here? Just make sure he knows that that one's tight. You can give him back the... Good.
Thanks.
All right, so while they're getting that done, we're going to then have 2 people, one on either side, with a tensioner. Okay. All right, so we're just gonna focus up here. Once that's tight, we'll start tensioning. You can see, I don't know if you can
It's
get
on
in there,
backwards.
Chris. It's really hard once you get it that close. So what you can do to help in the future is know that's going on and alter your wire placement, or if we don't put all of our struts or all of our threaded rods on ahead of time, then you can get them anchored down because we know up front and the back's okay, and then you can go ahead and you can slide your threaded rods in there afterwards or your struts afterwards. So we're going to tension, and what I want you to do is you have to loosen everything all the way up. So you're going to turn it all the way counterclockwise, and then slide it over. So you're going to do right here. And you put the little male end and the female end of the bolt there. So we know that he's on this wire, so I'm going to come up top and have Nicole slide in right here. And then what this does is just like the male end on the wrench bolt, it's going to hold the bolt from twisting. So you're both going to turn, and what we're looking for is, go ahead and start turning a little bit. Both at the same time, good. Keep going. And we'll see the lines start to slide down on here. Again, every tensioner is different from every company, but once we have these lines start sliding down, we know we're getting more tension. You can feel it tightening up. So keep going to 130. We're up in the leg, you're going to do around 120, 130, and the foot you're going to do around 90.
It won't go anymore.
Okay, and if you can't go anymore because it's just too tight, that's okay. But now we have tension, and so go ahead and once the tension's on the wire, we need to then tighten down the nut on the other side. So now take a wrench and tighten down the nut on the other side. This was kept loose beforehand, so that way you can get the appropriate tension. And now tighten it all the way you can. This is one area when everyone's tightening everything down that you may smack your knuckles or poke from another wire that's sticking out. So you just want to be careful you're paying attention here. Good, once you're tight, okay. Now you're going to counterclockwise unscrew that and take it off. And you'll pull it all the way off. Good. Good, very good. So what I want you to demonstrate is, let's bring this frame up here, and what we can see is when we talk about wires, so if you see somebody post-operatively in clinic, you can take a wrench and, let's use a crescent wrench. If you want to tap, you can hear, I don't know, hopefully you can hear online, but you can hear the different pitches between wires that are not tensioned at all and wires that are tensioned. The other thing you can do is if you push up and down, you should be able to have a little bit more pliability, and then you get this really tense wire here and it shouldn't move at all. So when you're checking patients post-operatively, you want to push on the wires and make sure they're very stable. If they're loose and they're bouncy, then we have concern that everything loosened up. Maybe it's an infection in the bone, maybe the wire just needs removed, but that's not a good thing. Once we are done putting a wire in, there are different ways that you can get rid of the exposed wire here. So you can clip it off. The other thing you can do is if you bend it, and bend back and forth, you want to bend parallel with the ring. That way you don't have a sharp nub on the outside there. So you can do that. Some people will cut a few fingers and curl it around the frame. That way if they need to tension it later on, you have some extra wire to work with. But you want to do something that's going to protect the patient from getting scratched, especially on their contralateral limb. Although most of the time we do have a big dressing over top of everything. But at the end, you're going to end up with all these wires that are tight like that. What we didn't get down to is we're going to talk about the wire placement for the foot. And I'm just going to use this end of a wire here just to show. Because the metatarsals in a rectus foot type are going to be angled like this, if we get a flat foot or somebody with Charcot, it may be really easy to go straight across. Sometimes what we have to do, is we have to go at an angle and get a few metatarsals, and then on the opposite side, get a few other, maybe 1 and 2, and the other side 3 and 4, 3, 4, 5. It's going to depend on their architecture of the foot. You can come straight across if we have olive wires and just get a couple metatarsals, but you want to make sure that you have the stability. So if we just have smooth wires here and you're putting them parallel, it's going to slide a bit. So either olive wires or angle them, and we almost are always building off of the frame with some posts.
Yeah, I never did that for the tibia.
Do we have any?
Yeah.
Sorry. Yeah, we always build off with some posts here because it's just the wire placement. We're not getting all of our stability here. But what you end up doing is if you're going to have somebody weight bear, the purpose of a frame like this with a weight-bearing patient is that way the forces are transmitted through the heel and they go all the way around the internal area here of the foot and ankle, and they're going to exit at the most proximal portion. So here would be the half pin, but if you didn't have that, you just have a wire in the proximal tibia. And because this is where all the forces then go from the frame back into the body, the proximal tibia wire is going to be the area that's going to have the highest likelihood of breaking first, assuming everything is put on correctly, because that's where the transition of forces are back into the body. So we want to have our most concern evaluating them post-operatively up top here. So this is, once you would finish tensioning everything, that would be your static frame. Oh, here we have a post if you want to see. So what we would do is, if you needed to build up or on the foot, you can build up and then off, and you kind of create a little bit of an L there to get wire placement wherever you need it to be.
So you don't have to bend the wire down.
The last thing we want to do is if you're putting a wire really far off, you don't want to bend it all the way down. And it happens a lot in the heel. So we just don't want to have wires that are bent all the way down, so you may be posting off there. It does decrease stability, but it's better than having a wire that's bent to start off with. All right. Any other comments or things that were... I think that's what's going to be it for today. We do want to announce, though, that next week, instead of having an actual lab that we're going to talk about, we're going to do our first monthly or our first annual or whatever we end up deciding to do. We're going to do our first ever steps trivia. So we're going to all have some drinks at like around 8 p.m. I think is when we're going to start. We're going to have some instructions sent out about how to play trivia on your phone with some foot and ankle trivia questions. And there's at least going to be a prize of a $100
Yes.
Amazon gift card.
$100 Amazon gift card. We love attendings and residents, but please, this is only for students. So whether you're by yourself, you're in a team, this is student steps trivia next Friday night.
Yep.
Okay.
So stay tuned.
Yes, we'll send those details out for next week. But next week, just have some drinks ready for an evening game of fun. Well, thank you, everybody. Enjoy your weekend.